There are a lot of misconceptions and misunderstandings when it comes to genetic testing for hereditary breast cancer. And in this video, I'm going to address some of the most common ones. One thing that a lot of people believe is that most breast cancer is hereditary, but that's actually not true. Only about 5 to 10% of all breast cancer is due to an inherited genetic mutation. The other 90 to 95% of breast cancer is really due to other risk factors. And these are some risk factors that may be in your control or not in your control at all. Some of the risk factors that are not in your control include breast density, how much estrogen you've been exposed to over the course of your lifetime because of the age at which you started having your first period and the age at which you underwent menopause, and things like radiation exposure. For example, people that have had radiation treatment to treat a Hodgkin's lymphoma later have an increased risk of breast cancer. And some risk factors that are more in your control include not being physically active, being overweight, especially after menopause, having your first pregnancy after the age of 30, and not breastfeeding. All of those are risk factors that can contribute to breast cancer risk. Another misconception about breast cancer genetic testing is that there are only 2 genes associated with hereditary breast cancer. A lot of people, when they think of genetic testing for breast cancer risk, think of BRCA1 and BRCA2. Some people refer to this as the BRCA genes, but more accurately, they're called the BRCA genes, BRCA1 and BRCA2. So a lot of people think that they only need testing for these 2 genes, but we actually know that there's at least 10 genes associated with hereditary breast cancer. Every year there's more genes that are discovered to be associated with an increased risk of breast cancer. So if you underwent genetic testing 10 or 15 years ago, that was probably only for BRCA1 and 2, and you likely need some more updated testing. Another misconception, unfortunately, a lot of people think that if their genetic testing comes back normal with no genetic mutations found, that there's no risk of breast cancer. And of course, we know that that's not true because, like I said in my first point, most breast cancer is not hereditary. So your risk may be the same as an average woman, or your risk may be higher if you have some of those risk factors that I mentioned earlier, or if you have a family history of breast cancer. So it's really important that even if your genetic testing comes back normal, that you're following the recommended screening guidelines for breast cancer. On the flip side, a lot of people think that if their genetic testing comes back showing that they're at high risk for breast cancer, that it means that they will definitely develop breast cancer. And that is also false. There is no genetic syndrome that will give you 100% risk of breast cancer. There are some genes that are associated with a very high risk of breast cancer. Other genes are associated with more moderate risk of breast cancer, and some are associated with a higher than normal risk, but really the risk is not even significantly high enough where we would recommend any extra screening. So it's really important to meet with somebody who can explain your own genetic test results to you, let you know exactly what your level of risk is. And depending on your level of risk, you would have different options available to you in terms of screening or taking steps to reduce your risk. But again, there is no genetic condition that will give you 100% risk of breast cancer. Another misunderstanding is that some people think that genetic testing costs thousands of dollars, and that's not true anymore. Genetic testing used to be very expensive, but nowadays most insurances will cover it if you meet certain medical criteria. And if you don't have insurance or you don't meet those medical criteria, you can usually pay out of pocket about $250. So it's no longer thousands and thousands of dollars. Another misconception is that genetic testing for breast cancer is only relevant for women and not men. And that is incorrect. First of all, both men and women can get breast cancer. And a lot of these genes that are associated with hereditary breast cancer can also increase the risk of cancers in men, such as prostate cancer or colon cancer. Also, a lot of men may want to have this information not only for their own cancer risk, but also to be able to pass on that information to their children, like their daughters. So genetic testing is important for men and for women. And along those lines, it's also important to think about both sides of your family, because genes related to breast cancer can be inherited not just from your mom's side, but also from your dad's side. So we should not keep men out of this conversation. And then another really common misconception that I see very often is that people think if they've already had breast cancer, why would they need genetic testing? Why don't we just test the people in the family that have not had cancer, for example, their children? Well, there's a few reasons why we actually want to test the person that has already had cancer. One is if the person is in the middle of treatment Having that information about genetic testing can be really valuable for treatment purposes. Breast cancer that is found to be hereditary through genetic testing can usually be targeted through different types of drugs, so there may be more treatment options based on your genetic test results. The other reason it's important is that, let's say a woman has breast cancer and she's found to have a genetic predisposition to cancer, that could give us important information for her future cancer risk. She may have a risk of developing another breast cancer in the future, or cancer in a different organ. So having this information will help to guide her future screening and risk management. And lastly, testing a person that has had cancer can also provide useful information for family members. It always makes most sense to test the person in the family that is most likely to carry the genetic mutation, and that is the person in the family that has had the cancer. If a mutation is identified in the relative that has had the cancer, then we know what we need to look for in everyone else in the family. So I hope this video has helped to clarify some misconceptions. If you have any questions about anything related to genetic testing for breast cancer, please leave it in the comments below. And please give this video a thumbs up if you liked it, and consider subscribing if you want to see more of this content. Thanks, and see you next time. Bye.